In this clip, we're going to be talking about the importance of hip rotation in the gait cycle and why it's important and what happens if we don't have enough hip rotation. So the general goal when we're loading the foot is that we want to load the foot across the width of the foot. So in the gait cycle, we would want to start with the outside edge of our foot touching down first, then we'd load the whole foot across the entire width, and then as our foot goes behind us, we load the inside edge of the foot or the medial arch. So we want to start here from this lateral arch on the outside of our foot, and this is the hip rotated into external rotation, really lets us maximize that outside edge of the foot. Then we're in a neutral position here, and the foot is sort of underneath us in gait, flat on the ground. And then as our foot continues behind us, we'd like to move into internal hip rotation. This is the groin and the thigh moving towards the groin here. And then we're loading the medial arch here on the big toe side of the foot. So the first thing to realize is that if we can't express one of these directions, either internal or external rotation, those represent 1/3 of our ability to load the width of the foot. So if we can't express external rotation in this manner to load the outside edge of the foot, we're probably going to start our gait cycle like this and really avoid that first third of the foot managing load in any way. So we're just going to start from here and end up here. So we're going to be putting 100% of the load through 2/3 of the foot. And the same can apply if we have external hip rotation and we move through gait to the center of the foot, but we're unable to pass load to the inside of the foot. We're going to use this third and this third through the gait cycle, but we're going to miss out on this final third. And we're going to end up again putting 100% of the load through 2/3 of the width of the foot. Now, a couple things tend to happen though if we're unable to express one of these ranges of hip rotation. The body's going to try to put the foot on the outside edge as best it can. So a couple different things will happen. So if somebody can't express external rotation, one of those options is that the knee is going to sort of dive out to the side here. And this compensation would be hip abduction instead of hip external rotation. This certainly accomplishes perhaps that we're putting the outside edge of the foot down. But what we can see here is that we've excessively lengthened the outside of this knee here. So this tissue is now longer. Instead of rotating at the hip to achieve this position, we've actually dumped the knee out to the side, over lengthening this tissue to achieve the outside of the foot. This is going to be commonly associated with pain on the outside of the knee or discomfort in the IT band. Another thing that we can see happen sometimes, if somebody doesn't have enough strength to actually load their knee out to the side like this, they're actually going to kind of have their knee move to the inside to try to steal whatever external rotation they can on the inside of neutral. So instead of moving away from neutral, instead of rotating, they'll actually dive deeper into this adducted position. And the idea here is that they're going to act like they get external rotation, but they're always on the inside edge of neutral. So this would be knee valgus. And in a situation like this, the person's knees will sort of cant underneath their hips. Instead of staying straight down, you'll see that their knees go towards their body's midline. And external rotation from them is here, but it's not really external rotation. It's just moving the knee out towards neutral, and they're sort of operating in this position, which is only on one side of the coin. And the same thing's going to apply if somebody can't go into internal rotation. Something will happen to try to fake that. So that's typically going to be that the knee moves into valgus again. If we don't internally rotate, we want to load the inside of that foot. So one way the body can do that when it can't internally rotate is to simply put the knee into this position, into valgus, as sort of a cheat mechanism. Now, this is going to excessively lengthen the inside of the knee. And so instead of having the hip rotation manage this function to put the foot on the inside edge, the knee is moving into this valgus position or overly adducted position, and the inside tissue here is going to be over lengthened. So we'll often see people have inside of the knee pain if they're unable to express enough internal hip rotation. Now, once that happens, somebody's got outside of the knee pain or IT band problems, or they have inside of the knee pain, they try to strengthen their leg. And that's a common plan. That's great. We want more strength. However, more strength doesn't necessarily give me more rotation. So while we might be able to feel more comfortable with this compensation or more comfortable with this compensation because we're stronger about it, the hip still isn't rotating. So the body still needs to find a way to manage that force in a way that's going to not just be sort of held at bay by the strength. So what we typically see is that the hip still can't rotate, so that the pelvis starts to shift instead. And you'll see the pelvis moving excessively which then will commonly lead to lower back pain. So a strong leg is great to avoid your knee pain, but that might just direct the force up to your lower back. All along, if this leg were just to acquire sufficient rotation, that's probably going to be a common way to solve for a lot of knee and low back problems. There's plenty of people who are strong who have knee and back pain. There's plenty of people who are weak who have knee and back pain. The common theme that I see is that these people have difficulty expressing internal or external rotation, or they might express a range of motion, but they're not actually feeling it controlled around the hip. They're feeling this effort controlled somewhere down by the knee or even the calf, or some people even feel their hip rotating in their back because they don't have real good control over hip rotation itself.